So can you give us an idea of some of the recommendations that were made? I mean, so you do a complete analysis of analytics within your organization. You talk to the executives, you gather that information. Um, can you give us an idea of what the executive summary to that might be
Mhm.
to the group?
Yeah. So part of it had to do with we were just understaffed, and I always hate the idea of adding staff if we don't have to. It's a big topic, but the truth of the matter is we didn't have the right number of staff to make this happen. But more importantly, we were missing key staff functions that weren't there, and part of the problem was a disconnect, frankly, between what the requester wanted to communicate and what the BI developer heard and then built. And so that the delta between that communication is really what led to a lot of inefficiencies in our system. So what we did was we took a look at that and we said, how can we best improve on that? And one of the positions that we added was this clinical data analyst, which is really somebody who can really understand well what's being asked. This particular hire, who's awesome, had a background as an ICU RN and then was an Epic analyst for several years, really understood things well, and then learned reporting. So he understood the clinical side. He had some operational background as well, and then now he understands the reporting side. So those conversations now are much cleaner, much clearer, much more defined out of the gate. So we understand the ask a lot better. So you're not pumping out 30 iterations of a report. The second big position that was kind of different was our principal trainer position, which was, this is a brand new position, not usually something you find in analytics. But what we recognized is that folks weren't able to really fully comprehend the information we were delivering to them. So the goal with this position was twofold. Number one is to really spend time with the folks who are requesting information and getting reports and dashboards, et cetera, so they really understand what's in front of them so they can take action on them. But the second piece, which is probably even more important, is we also recognized we couldn't continue to scale and just add positions. We had to add self-service as one of our strategy frameworks moving forward. And so this person would be in charge of teaching folks how to leverage self-service to meet part of their reporting needs.